Hello, welcome back on IAN's Health Talk with Dr. Akram. Today we are talking about stroke. Stroke is really important. This is, as I explained in my talk in the beginning, this is one of the major killers in our society. And identifying the stroke on time and getting medical help straight away will prevent or will halt the progress of the disease, and you will have a better outcome. And on our show, our special guest and my good friend, Dr. Lankanatha Alwis, is around with us, and he is the best person in the studio, apart from me, to answer all our questions. Of course, he is educator for medical students, and he teaches in FRCP courses for doctors, and he's an examiner as well. My God. Okay,
thank you.
Lanka, good to see you again. Okay, let's talk more about stroke. What immediate treatment available in NHS? Oh, before that, when do we need to call help?
As soon as possible. We discuss about how the brain cells are affected when a stroke develops. You lose about 2 million neurons per minute. So we discuss about common symptoms of stroke. It's not really rocket science to suspect a stroke, right? When that happens, the key message is you should call 999, because in UK, all the ambulance services are geared up to dispatch a paramedic crew trained in identifying or suspecting a stroke, and they'll be with you within a very short period of time. I'm talking about 5 minutes, 10 minutes, that sort of time. And they will quickly assess you, and they will take the patient to the nearest specialist stroke unit. So why do they do that? There are interventions that can be done for selected stroke patients to try and completely cure or minimize the damage.
Let me jump with the question. When can someone call an ambulance? So you said about fast. I still remember that word.
So let's quickly summarize again the symptoms of a stroke. Sudden paralysis of your limbs, arm, leg, losing facial symmetry, inability to talk suddenly, double vision, losing your sight partially. There are certain conditions which may mimic stroke, which are not strokes but which will give you symptoms similar to stroke. For example, migraine is a common condition which people develop neurological symptoms, but there are differences. Migraine symptoms develop a bit gradually, and they say migraine is a magician, stroke is a thief.
Stroke is a thief, migraine is a magician.
Yes, stroke, a thief would come quickly and get the stuff and go, very abrupt, isn't it? So similarly, stroke will take away your power, take away your speech, take away your balance, your memory, your vision, your facial symmetry. And all these are negative neurological symptoms, whereas migraine, you can get positive symptoms such as headache. A magician, you'll see flashing lights, zigzag lines, tingling sensations of your hands. But the key message for our viewers is, do not wait to diagnose a mini stroke, migraine, or a stroke by yourself. If you develop sudden neurological symptoms, and if a stroke comes to your mind, or if you see your family member or your friend or your colleague at work suddenly acting abnormal or showing signs of a paralysis, call an ambulance. Do not waste even a second.
Call an ambulance immediately. If
999, not
999,
not 111.
If any signs of stroke, what we said, fast. The time is ticking. We got about 7 minutes left. Let's run through the treatments. Okay, we call an ambulance. The ambulance has come there, and the patient is in the hospital. What do they do immediately?
So usually the paramedics will notify the stroke team before they arrive, and in most centers, the stroke units, a stroke specialist nurse or a doctor will be there to receive you. They will quickly assess and do a brain scan. The reason to do a brain scan mainly is to identify whether it is a bleed or a blood clot stroke, because the treatment is completely different. If you have a blood clot stroke, which is the majority, now we have special treatment. Quick question, Akram. If your sink is blocked in your house, what would you do?
First of all, I would go to one of these corner shops or one of the supermarkets, buy some thick bleach. Correct. Or something similar.
Yeah.
If it doesn't work, I'll always call a plumber.
Good, thank you. So this is similar thing we can try to do, but a specialist will take a decision to, after looking at the scan and assessing you, to see whether it is suitable to give such a chemical to unblock your pipe.
So the chemical and you have to give it quickly, is that right?
Exactly, because if you give this medication to the bruised brain, or if it is delayed, this medication itself can cause harm by causing a bleed in the brain. So it should be given within 4.5 hours.
So that's why the time is important here.
Absolutely.
Okay.
So you can, if it is given quickly, you can salvage more neurons, more nerve cells.
So this is clot busting treatment, and the other one
is the other thing you mentioned. You will get a plumber.
You get a plumber.
Yeah. So other selected cases, you can do both actually, give the medication, and if it is a big clot in the brain, a specialist interventional neuroradiologist in a particular center can put a wire through the groin, guide the wire to the brain, get the clot out, suck the clot out.
Okay.
So this is a very, very efficient treatment. In my opinion, this is the best invention or in medical science over the last decade, because if you do it for 3 people, at least 1 people will have significant benefit.
Significant benefit.
Number needed to treat is less than 3.
So there are 2 treatments. One is the clot busting treatment. The second one is you pass a guide wire and locate that clot where it is and pull it out. It's simply as it is. Okay, quickly, I've got 1 minute left. And let's say rehabilitation, what we do quickly.
Yeah, so whatever, if it is a bleed, you can't do this. Bleed or a blood clot stroke, and then the patient will be admitted to the stroke unit. There are specialist therapists to look after you. The stroke team, they will do 3 main things. One is to prevent complications.
Prevent complications?
Such as pneumonias, further blood clots, and further strokes. Number 2 is to find out why the person has...
Why it happened?
Yeah, so etiological investigations or blood tests to see why they had a stroke. Thirdly is to help recovery.
Recovery.
If you miss that time period, the recovery, Akram, is by yourself. There aren't any magic medications available widely to try and regrow the brain cells and that sort of stuff. So the therapy is... So that is why that you should come to hospital within that 4.5 hours, sometimes up to 6 hours. But as soon as possible, to see whether it is okay to...
That's why the time is important, because the faster you go, the treatment will work better. Even clot busting treatment, all they have still time to pull that clot out, and the recovery is better. Yeah. There is no specific treatment for...
Well, there are treatment for the complications, and there are trial treatments to help brain cells grow, and there are many things. But after that period, the recovery is by the brain itself. Therapy is to kind of promote and help that. So there are specialist speech and language therapists, physiotherapists, occupational therapists.
Excellent. Lanka, unfortunately, we're running out of time. Wish we could talk a bit more, and there's another one we want to talk is stroke and difference between stroke and mini stroke. Quickly, few seconds.
Mini stroke is transient symptoms we discuss.
Transient symptoms.
And which gets better quickly. Okay. For descriptive purposes, we say if symptoms get better within 24 hours, it's a TIA. But true TIS gets better quickly. It's an important thing because all the stroke units, they have TIA clinic, because a TIA or a mini stroke could be a warning for a big stroke. So
Excellent.
then you have to do brain imaging and looking at your blood vessels.
So what you're trying to say is it does not matter you get a stroke or mini stroke,
Well,
you
the
call
key
the helpline.
Yeah.
Yeah?
Key message, Akram, is don't try to diagnose mini stroke by yourself. When you, the first second, you get the symptoms, call ambulance.
Okay. Lanka, it was really nice, and we had really short time, but we still managed to go through most of the stuff the general people should know about stroke. Yeah. Thank you very much. It was a great talk, and what's the message is in the end, don't forget fast.
Yeah.
Fast is really important. Your time is ticking once your brain is attacked. Yeah. The faster you go to the hospital, the faster you get the treatment, the faster clock is busted, or the faster clock is pulled off, and you have better recovery.
Yeah. Akram, one message we must tell the viewers: the COVID situation, COVID infection, it has shown that increases risk of stroke. I know people have anxieties coming to hospital, but all the hospitals are trying their best to avoid stroke assessment areas and scanning areas free of infection. So therefore, if you suspect common symptom of stroke, come to hospital. And also the final important message is the best way to treat a stroke is not to have a stroke. So prevention is better than cure. Like we wash our hands and keep our exterior clean, try and keep our interior clean as well, your blood vessels, by not doing the things we have discussed like smoking and having good food habits and exercise. The most cost-effective intervention is exercise.
Thank you very much for joining us with a special show with Dr. Lankanatha Alwis. He is the stroke specialist in our studio, and he has given wonderful advices for us. Until we see you next time, thank you very much, all of us from my side and from Dr. Lankanatha Alwis. See you again next time in a great show. Until then, look after yourself.